Good afternoon, everybody. That's loud enough. My name is Josh Fidler. I have the honor and privilege of chairing the Neurosurgery Advisory Board and introducing Dr. Brem. Welcome all to the installation of the inaugural Harvey Cushing Lecture at Johns Hopkins Medicine. I want to thank you for joining us today on this historic occasion as we formally install this lecture. It's been a dream of Henry's, I know, for some time. It's actually a most auspicious time to visit Hopkins for those of you who aren't here every day. This week we dedicate the Zayed and Bloomberg Towers, 1.5 million square feet, 560 beds, 33 operating rooms, including 14 for neurosurgery, 42 radiological suites, 96 ICU, treatment area, et cetera, et cetera, et cetera. It's pretty remarkable. These buildings essentially replace the entire old hospital and absolutely usher in a new era of evidence-based, patient-centric care and research at Hopkins. And in that regard, I'd particularly like to recognize Ron Peterson, who's here with us today. Ron is the president of Johns Hopkins Hospital, his wife Rooney with him, and that they can share sometime this week with us is a wonderful treat because I know they are running like mad. So Ron, if you would stand up and be recognized. I'd also like to take a moment just to recognize those who've traveled from distances, period, and those of you who serve with me on the Neurosurgery Advisory Board. We have a really extraordinary group of individuals who volunteer their time and assist Henry and the department, well as the development team, Kim and Emily, with unlimited guidance, advice, and certainly we represent an enthusiastic Greek chorus. We certainly share in recognizing the department's success, and it's because of your leadership, Henry, and those assembled from the department today that we value our engagement around here. From the advisory board, if you would stand briefly, we'll recognize people at the end. It's just 8 of us or so. So George and Mary Nelberry from Philadelphia, Peter and Allie Jennison from New York, Gary Ganaway from New York, Barry Wessler from DC, saw Barry, and I don't know if Lenny and Phyllis Atman made it, but colleagues of mine from here in Baltimore. It's my honor now to introduce our first speaker. I'd like to welcome to the podium my friend, my brain surgeon, and the Johns Hopkins Harvey Cushing Professor, Director of the Department of Neurosurgery, Dr. Henry Brem.
Well, this is a great moment to be able to honor Harvey Cushing, who we almost take for granted in his legacy here at Johns Hopkins, but he was truly a transforming factor in American medicine, not only in neurosurgery, really the father of American neurosurgery and of modern neurosurgical care. This is a very auspicious week for Johns Hopkins Hospital, and I appreciate everybody coming here. And there are many competing events. Actually, they're taking place to celebrate this very special week where we opened a new hospital. And so I'm particularly appreciative to all those who could make it here and join us in this celebration, both of our heritage through honoring and thinking about Harvey Cushing and what he did at this hospital to transform American medicine, world medicine, as well as to Johns Hopkins Hospital, and as well as to honor one of our great leaders in American medicine, Ben Carson. I do want to look back a little bit, and we're going to look backwards and then we'll look forwards. But when we look backwards and we think about the momentous events that are occurring this week at Johns Hopkins, where, as Josh Fiedler mentioned, we're opening an extraordinary new institution that will be transforming. When you look back to our history here, that Johns Hopkins Hospital actually opened its doors as a hospital in 1889, 16 years after the death of the eccentric Johns Hopkins, who had left $7 million to form a university and a hospital. The university was completed in 1876. It took them 12 years to build Johns Hopkins Hospital. It was done under the direction of John Shaw Billings of the Surgeon General's Library, who had considerable experience in the construction of Army hospitals following the Civil War. The plans embodied sweeping reforms in hospital planning and construction. But the real hospital, he told the Board of Trustees, quote, is the moving and animating soul of the institution, which is to do its work and determine its characters, which consists of the brains that are to be put inside of it. And that quote of Billings in the opening of the Johns Hopkins Hospital in 1889 holds true in 2012, that the extraordinary intellectual firepower, the extraordinary devotion to better understanding human disease, better understanding science, and transforming that to the benefit of each individual patient has been the overriding theme and accomplishment of this great institution, and in this landmark moment that we sit at as we open the new hospital. Harvey Cushing was a transformative figure of, peerless. He joined Johns Hopkins Hospital as a resident under Halsted in 1896 on November 6th. It's interesting, and you'll hear much more from Alfredo Quinones about it, but in the decade, the first decade that he was here, when he looked back at the numbers between 1889 and 1889 to 1899, there were 32 brain tumors that were diagnosed from the 36,000 admissions to Johns Hopkins Hospital. Of those 32 patients in 10 years, 13 were transferred to the surgical service. 2 of them actually had operations. Both died immediately postoperatively. So that was the face of neurosurgery in 1899, at the time that Harvey Cushing became a surgical resident here. Over the course of his career, he transformed the field, he and others, but he is certainly responsible for many of the advances. And in fact, one of the landmark cases that he did before leaving Hopkins and going to the Brigham, it was in 1910 when he operated on February 5th on Major General Leonard Wood to operate on a meningioma. And that had not been successfully done. In fact, the first operation that he did on February 5th had to be stopped because of the massive bleeding, and he simply took the skull off and then came back on February 9th and successfully completed the operation. There's a quote that this was the general of the Army and the advisor to the president and a real war hero, and his personal physician said that he was stunned by the success of the operation. And in Cushing's biography, he says, and so was I. So he was greatly relieved, since the eyes of the world were on this operation, that it actually worked out. In 1904 was really the birth of our specialty, when Harvey Cushing, in a lecture in Cleveland, Ohio, made the following opening to define the area of neurosurgery. And let me quote it to you, and you'll see how our specialty was born. Harvey Cushing said in 1904, I shall attempt to formulate some personal views concerning a branch of surgery which in this country, at least, largely owing to the allurement of other and more promising fields of operative endeavor, has hardly received the attention it deserves. Through the generosity of Dr. Halsted, his junior associates have been given, in a measure, the privilege of directing the work in some of the subdivisions of his large surgical clinic, in order that they may concentrate their efforts towards the advancement along particular lines. It has thus fallen to my lot, temporarily and under his guidance, to control the group of cases which present features chiefly of neurologic interest. And it is upon this present possibilities and limitations, as well as upon the future outlook for this Department of Surgery, that I shall briefly dwell tonight. I must say that Halstead gave him that privilege, but also told him that he would never be able to make a living through neurosurgery, since there just simply was not enough that would keep one surgeon busy full-time if he specialized in neurologic surgery. Cushing changed the field of endocrinology, anesthesia, neurosurgery, medicine, medical education, research through his transformative work. He would not recognize the new hospital that Mr. Peterson and Ed Miller have created here. He would not recognize what we do in the operating room today. The 23 members of our department, which has been rated by U.S. News & World Report as the best neurosurgery department in the United States, certainly is in the spirit of what he would have expected, but he wouldn't recognize how we do what we do with the imaging, with the anesthesia, with the advanced techniques that we use. However, I think what he would recognize is exactly the same spirit of devotion to patient care and to science that he really laid down as the fundamentals of how medicine advances and how neurosurgery advances. And what he would recognize is the unwillingness to accept the present outcomes in neurosurgery as being adequate, and the constant pushing of every member of the faculty, every resident and medical student who works with us to not accept the present outcomes, to master them, to be the best that can be at them, and to devote their lives to mastering their trade, but to using science and using scientific techniques to change the way people look at neurosurgery and at medicine. And in that sense, his transformative genius is very much alive and well in our department. I would like to take a few minutes to have Alfredo Quinones present some of very, very interesting research that he's been doing through the archives about Harvey Cushing and what we learn about his creative genius during his Baltimore years. Alfredo has published more than 30 papers in the last 2 or 3 years, going through the archives and studying the Cushing years and understanding what extraordinary advances he made during that Hopkins period. Let me just say a word about Alfredo Quinones. Many of you know that he is just an exceptional person. He recently, if you want the real details, there's a great book called I'm Becoming Dr. Q, which is his autobiography, part 1. It's just the part up to 2012. But Alfredo grew up in Mexico in poverty with a very devoted family, but very poor. And he came across as a migrant farm worker. He was brought back to Mexico. He again came into the country. Within 2 years of his being a migrant farm worker, he had learned English and became a full scholarship to Berkeley, and then followed by a full scholarship to Harvard Medical School. He was extraordinarily successful at Harvard Medical School in his research and in his clinical acumen. We did our best to recruit him here to train with us, but instead he went to UCSF, where he was a phenomenon. In fact, the chairman there said that when it was clear that we were able to recruit Alfredo back to our faculty, he said that please take good care of him. He's the best person that he's ever trained in his career, and that we need to know that we had a precious diamond in Alfredo with us. And I assured him that he would flourish in our environment, which he has more than that. He's been an explosion of activity and creativity, ranging from a laboratory which inspires people from underprivileged areas, our medical students, residents, faculty from all over the world to come to study with him, doing breakthrough work on stem cells and many basic science areas of brain tumors, to extraordinary clinical acumen and expertise, and a tremendous desire to understand and motivate how to change the field of neurosurgery and inspire others to follow his pathway. Part of that inspiration comes from studying and understanding the past. And in addition to everything else that Alfredo is doing, he has become a student of history, and really particularly with a focus on Harvey Cushing. So I'd like to ask you to join me in thanking Alfredo and hear his beautiful remarks about the Cushing years.
Thank you, Henry. Well, I'm going to try to disconnect Dr. Carson's computer here. Dr. Carson, I'm sorry. I'm just going to try to put this. Thank you, Henry. After that beautiful introduction, I think that everything is going to go downhill. I hope you don't mind. I'm going to do my best to keep up with the incredible remarks from Henry. I will, if it's okay with you, over the next about 20 minutes, 15 to 20 minutes, and about 13 minutes of that will be slides with some pictures. I will take you through some of the life of Harvey Cushing, some of the work. There are so many people to thank, and I am so sorry. I can literally put every single one of these slides with people to thank at this institution, starting with Henry, colleagues, many faces that I see here in the audience that are dear friends and colleagues. But I will instead concentrate on Harvey Cushing and his experience. But I'd like to thank, obviously, Courtney Pendleton, one of our stellar medical students who is recently matched at Jefferson in neurosurgery, and she's really the person that has led this effort. So I don't want to take credit for the incredible work that she has done. And I've been privileged to be able to learn from her and the trips that we did together to the historical library. So I'll take you from 1896 to 1912 with some pictures, and then we'll end up with an incredible movie that I have for you that one of my students edited in black and white, and hopefully I'll bring you back to his 2000 craniotomy. And it's one of those few records in time, and it's in black and white, and it's narrated by one of his residents, and it's absolutely beautiful, and I want you to see it. So I'm gonna move to that. Obviously, as Henry said, I just want to echo that. Harvey Cushing really was a pioneer, and thanks to his work, we can do what we do today. And as Henry said, several decades later, he celebrated his 2000 craniotomy when he was at Harvard. And here at our institution, we do in 1 year even more than that. So clearly things have evolved, but it was thanks to him. This is a picture that I actually just scanned from a book that Henry actually gave me, and that's The Life of Harvey Cushing by Bliss. And this was actually obviously there at age 2. And this is him at Yale in 1889. I don't know about you, but I've never been able to do that. And I didn't even try, but he was an incredible athlete. Everybody knows this was him in 1991. This was him playing baseball. And I'm going to link that because there's going to be an anecdote in the video that is going to link this picture to his life, obviously. And that's him in the front, the second one right here, when he was playing baseball at Yale. So these are some of his illustrations, and I'll show you a few more. This is when he was a medical student at Harvard. This is when he began to do the recordings for anesthesia. He was so meticulous, and he was such an incredible artist, and that he continued to do that. I'll link that also to the movie that you will see. This is a picture here, all-star surgeons in Baltimore in 1904. As you can actually see their names right here, and there's Harvey Cushing right on top of Halstead, right, standing right up behind Halstead right here. And obviously this was an incredible relationship. The changes before that, we have to remember that most surgeons went to Europe to get training. And it was thanks to Harvey Cushing and his colleagues around this time that the tide began to switch from Europe to the United States. So many people by the 1930s and 40s began to come back into the United States to get their advanced training. He was someone who depended a lot on mentorship, just like many of us do, that was privileged. He worked very closely, in this case, with Osler. We know he wrote an incredible book that was an award-winning book, and they had an incredible relationship. And that was also the beginning, as Henry said, of this issue of the pituitary. And he began to do transsphenoidal surgery here at this hospital, sublabial, which is eventually is a surgical approach that he abandoned because at the time the mortality was incredible. We didn't have lighting, we didn't have endoscope, no microscope, no antibiotics. And imagine he was doing that with the light of day, and we have, Courtney and I, we have, seen some of these records, and he writes that the surgery was difficult, there was not enough lighting, but he was amazing in the things that he was doing. I put some of these publications just to illustrate how many people have contributed to our understanding. I know Henry gives me credit and I give Courtney credit, but the reality is there's so many people, in all the fields. I mean, Dr. Carson has co-authored, George Shallow right here, Peter Berger, a lot of our colleagues. We looked at pediatric gliomas, spinal dystrophism, plexus tumors, intraventricular gliomas. We look at brainstem gliomas. Just 2 weeks ago, we did a tumor, George and I, that was an incredible tumor, and he was doing this 100 years ago with no lighting, no microscope. And it was amazing, obviously, the way that he began to move this, obviously, in an incredible way. Ventriculostomy, third ventriculostomy. This is actually the picture of a patient, of an infant, an African-American infant. Name and age is unknown. He was treated at Johns Hopkins Hospital. This is a picture that we just found at the archives at the Yale Library. Courtney actually had a scholarship to go out there and study about a month ago, and we retrieved a lot of these original pictures. He was from Johns Hopkins, and this is a picture that Cushing brought to Yale, and he was actually using as a case to teach the proper operative repair of spina bifida to medical students and residents, not only at Johns Hopkins, but subsequently at Harvard and at Yale, where he ended up in his last years. This is the operative note. These are original handwritten notes that have never been published. They're a little bit difficult to read, but this is a 13-year-old African-American girl that was treated for epilepsy, infantile paralysis, possible cerebral palsy. The note reads, to expose site of lesion, it would have been necessary to divide these vessels, one of which had already been slightly injured during the procedure of opening the dura. The patient's condition precluded further manipulation. Stimulation of the cortex with unipolar electrode has shown that no response could be called out posterior to Rolanded fissure. Hand and arm anterior to in gave prompt and vigorous motor responses. The bone was removed, the wound was closed with interrupted sutures, and in the second picture illustrates Cushing's use of meticulous operative technique, concern for patient safety, and use of advanced operative technology in a patient that was African-American. Just like this, one of the things that I have learned as I've been reviewing these original notes is that he treated everybody with the same amount of respect. His medical notes were absolutely impeccable. And I used to think that motor mapping was something that we had been using over the last 2 decades, but he was actually using this 100 years ago. He was stimulating the brain so he could actually safely resect parts of the brain, or sometimes back down and not do the surgery that he was trying to do. These are some of the papers that we have published. You can actually see all the way from metastatic breast cancer. This is a paper that we produced, obviously, with our colleagues Diego Caslan, to the spine. Patients where transfacial approaches were utilized. Meningioma, this is a paper that we just recently published with Alessandro Olive, and Meningiomas is the director of our Meningioma Center. So this is another operative note. This was by this time we're about 1906, 1907, if I remember correctly. They were typewriting these notes here at Johns Hopkins. This is a 30-year-old African-American man who was treated for a brain tumor and required more than 2 days of artificial respiration, while Cushing attempted to improve his condition through pharmaceutical and operative interventions. This case was written in an article that we recently published in World Neurosurgery, and then after this, what happened is the patient ended up going back 2 days later after mechanical ventilation, but back then everything was done by hand, took him back to the operating room for what he thought. He didn't know if the patient was going to recover, so he took him back and did cortical stimulation to see whether or not his brain was still connected and was sending signals to the rest of his body. At this point, he realized that there was no real meaningful function, and the patient was then sent back and expired shortly thereafter. But he was using some of the incredible state-of-the-art technology at the time to be able to do this. These are some of the papers that we have published, and I won't spend a lot of time. It would take a whole lecture just for any of these sections, I believe, but I used just to illustrate the amount of people that have contributed enormously to this. This is patients that were operated for the pituitary. I think this is something that has been a fascination. I present you with one short case. This is a case titled, "The Autopsy Was Conducted Under Most Inauspicious Circumstances, John Turner." And I'm going to show you the next operative note right here, all righty? This is Dr. Crow's note reflecting arrangements for the autopsy. Cushing handwritten addendum at the bottom reads, "This autopsy was done in the undertaker's establishment while the service was going on," and put exclamation points. He was so dedicated. He wanted to find out the origin of this. He went all the way to Washington, D.C., paid the undertaker $50, if I remember correctly, to be able to perform the autopsy. This was his incredible amount of dedication that he had to this. His innovative techniques were amazing. This is actually, now present one of these cases. He used all the way from pituitary transplantation, motor mapping, and transplantation of a human being to treat hydrocephalus. You can see the co-authors in some of these papers. This is an unusual case that we produced actually with Gustavo and one of our colleagues, and Courtney as well. And you can actually see it was the first attempt over 100 years ago to transplant the human pituitary, and it was actually published in Nature Endocrinology. And you can actually see that he not only tried it once, but several times, and successfully that tissue actually was able to provide function to the patient. The patient ended up dying. This was an incredible, it was written in the New York Times, and he was just, they said that he was doing things that were unsafe. They never really found out what was the cause of death. So then Courtney went back and looked at the records. It turns out that he had died, not of the transplant, but he had died of pneumonia, actually. And at the time, there were no immunosuppressants. But nonetheless, he was way, way ahead of his times. And peripheral nerves, he was doing xenotransplantation using a rabbit spinal cord. These are the things that he was doing over 100 years ago, which were absolutely incredible. This is in regards to non-neurosurgical cases. You can see this is a recent case that we published in glaucoma, obviously, with Dr. Subramanian in neuro-ophthalmology. So clearly, he was a visionary. In regards to safety, he was incredible in the way he documented errors at the time. There's another paper that we produced in the Archives of Surgery in addition to other papers. In regards to trauma, he was absolutely innovative. I mean, he was using fat. Now we know that mesenchymal stem cells do exist in fat grafts, and he was doing things that were way, 100 years ahead of his times. Brain trauma, and now we'll present another one last case of a 60-year-old man in which Cushing illustrates the resection of the Gesserian ganglion and postoperative herpetic outbreak in the left P3 distribution. As you can actually see right here, this is the actual picture of the patient of the distribution. He will just take meticulous notes, and you'll see in the video that we're going to present right now. This is a picture of his family. I took of the Bliss book, obviously. This, if I remember correctly, is 1916, as you can actually see right here. This is a picture with his children. Despite of all the success, unfortunately, he obviously, tragedy hit close to home. This is the actual newspaper article around 1926 in which William Cushing, they documented his death in an accident. So there were clearly an incredible amount of things that happened during his lifetime. So his contributions were absolutely phenomenal. He, despite of all this case illustrates an incredible connection that he also developed with his patients. And this is one case that demonstrates the profuse gratitude in the face of less than ideal results. Listen to this. 38-year-old patient presented with symptoms consistent with a left-sided lesion. He underwent an operation. Cushing expected a brain tumor. There were no images at the time, but upon a second operation, he discovered a thrombosed middle cerebral artery. It was actually a stroke, possibly indicating an ischemic event. This is the illustration in the operating room after following the surgery. And despite of all this, less than optimal outcomes, this is what the patient wrote. He will require that his patients write to him at least once a year following the surgery. First of all, the patient said, "My life, my soul, my body, I owe to you and God. I am gaining nicely, and it is the first time for pretty near 3 years that I thought I would write to you today." He wrote back in 1911, "Again, I want to thank you with all my heart that you have saved me. Of course, nature is trying to heal in the brains, but nevertheless, it was you who saved me. There's no doubt about it." 5 years later, so in a way, I am happy because of the last 3 years, it's been a beautiful world. Even now, I cannot express myself the way I want to, but I go where I please now. I was in Los Angeles and San Diego last spring myself, and that is proof that I go where I please by myself, and for a good many years, I could not do it. It was certainly a wonderful operation in Baltimore. So clearly, his patients were very thankful. This actually made the cover of the Fowler just about a couple of months ago. I present this last table before I go into the video, which is going to be about 7 minutes. This is the breakdown of the operative cases that Cushing did by 1912, before he left Johns Hopkins. These were 700 cases. 564 of these patients, 80% were Caucasian, 4.6% were African American, and the other ones were race. And now we know that some were Russian, some were Eastern European, a lot of people obviously. But he clearly, with all the documentations that we have seen, he was so meticulous. And at least in what we see in the documentation, he treated everybody with the uttermost respect. I am going to treat you and treat myself also, because I'm really excited about this video that I'm going to present. If we can actually potentially put the lights down for this. Is a black and white video that we have edited. Originally was about 30 minutes, and we brought it down to about 7 minutes.
And we recall one day when two small boys climbed up into one of the poplar trees just outside the windows to get a good view of all that was going on. When he uncovered the brain, the boys' excitement gave them away. The chief walked over to the window and, looking over his glasses, said very sternly, "If you boys cannot keep quiet, I shall have to send you home." Many of the medical leaders of Europe had stood in these stands, including the Russian physiologist Pavlov, whose long beard, since he refused to wear a full mask, almost touched the open wound. Dr. Cushing's reaction to the cameras was a mixture of tolerance and impatience. The photography was done with his permission, of course, but the details bothered him, and he tried to control the scene taking. When he felt that something was unimportant, such as the scrub-up, he tried to stop the cameras, and several times he deliberately blocked the view of the operative site with his shoulders. However, this did him little good, for whenever the view from one camera was blocked, the other camera took over. He soon caught on to this and gave up. At the end of the operation, Dr. Cushing wadded up a wet sponge and threw it at my head, remembering perhaps the years when he played shortstop on the Yale baseball team. A tumor of the pituitary, although devastating in its biological effects and the damage that it does to vision, is usually quite small and is therefore difficult to demonstrate in pictures such as these. Dr. Cushing employed a full-time medical artist named Mildred Codding, whose excellent illustrations are to be found in all of his publications from the mid-20s onward. She had trained with Max Brödel, the great teacher in medical illustration at the Johns Hopkins Hospital. Another invaluable assistant was Louise Eisenhardt, who had taken up the work of the neuropathological laboratory after Percival Bailey left for Chicago. Originally, she was Dr. Cushing's secretary, but she had later gone through medical school and trained in pathology to become a specialist in the differentiation of brain tumors. She co-authored with Cushing the large monograph on the meningiomas. The electrical contact, of course, was made through whichever hemostat or forceps was holding the bleeding vessel. This modern version of medieval cautery, developed at Harvard, had been available to neurosurgeons only since 1927 and was invaluable in controlling small vessel bleeding in deep holes. Operation on a cerebellopontine tumor, Dr. Cushing had inserted a pledget of cotton in the angle, and the assistant had not seen him take it out. He began to worry about it, but only after the chief had closed the dura, the muscle, the subcutaneous fascia, and the skin with his usual meticulous care, did he summon up the courage to say, "Dr. Cushing, did you mean to leave that piece of cotton in the angle?" Without a word, Dr. Cushing picked up the scissors and removed every stitch, looked up in the angle, removed the piece of cotton, and closed the wound again, layer by layer. A few days later, we did another posterior fossa tumor, and Dr. Cushing again put a piece of cotton into the angle to control the oozing. I kept my eye on that cotton for 4½ hours, and again hesitated, on the verge of calling it to Dr. Cushing's attention, until the last stitch had been put in. Just as before, Dr. Cushing reopened the incision painstakingly, looked in the angle, and what do you think he saw? The resident groaned. There was not a thing there. The applicants were required to be single, and it was understood that marriage would not take place until the full training was completed. The starting salary was $300 per year for house officers and rose to a handsome $1,800 at the resident level. In 1901, of the Hunterian Laboratory at the Johns Hopkins Medical School. The Hunterian was destined to become the forerunner of all other experimental laboratories, including the Laboratory for Surgical Research here at Harvard. Harvey Cushing was one of the reasons why the transatlantic movement of medical men reversed itself. In earlier years, young American physicians had flocked to Europe, as he himself had done, to sharpen their skills under the famous leaders of the time. Now Europe was turning to America, coming over in droves to the teaching centers in this country. One of Cushing's many talents was his ability to sketch, and his case histories are generously illustrated with pen and ink drawings made as soon as the operation was finished, which show the various stages of the procedure. These were useful later on as he worked up the cases for publication, and they were all Part of each day's chore was the examination of the patients who had been operated on during the preceding 6 or 8 days. Dr. Cushing usually took care of this himself. Back in 1905, when Cushing first turned his attention to the surgery of the brain and the spinal cord, he requested that all of his patients write to him on the anniversary of their operations. This practice enabled him to collect data concerning the end results of his surgery and ultimately to learn of the probable life expectancy of patients having a particular type of tumor.
He was, at the time when this video was shot, he was about 16 months away from retiring from his duties as a surgeon-in-chief at the Brigham and Women's Hospital. So thank you very much, Henry, for having me, and I hope you guys enjoyed that wonderful video. And I'm going to reconnect Dr. Carson's computer here.